Dementia Researcher with a blog and a rating.
Let's talk about impact. What is impact? When we think about impact, we probably think about policy changes, big reports and national guidance on care delivery, such as the NICE guidance. Whilst that is very important and can cause changes on a larger scale, the research and work we do can generate so much impact we probably aren't aware of. This is before we even have findings. That doesn't make it any less valuable though. So in fact, I would argue that this lower level impact on people's lives, abilities, knowledge, and perhaps working practices can be just as meaningful as top level impact and guidance. So how might we as researchers be able to generate this impact, apart from the big policy changes? One way we can increase knowledge, and maybe changes to behaviour, care access and care delivery, is by involving people living with dementia, their carers, and health and social care professionals in our research as team members. Involving those with personal and professional experiences obviously strengthens the relevance and focus of research, to make sure we address those issues that are the most important. As part of this, we as researchers can learn a lot from people with direct experiences of dementia, be that how they try to navigate the social care system or getting a correct diagnosis, to how care home staff struggles with providing care because of staff pressures, lack of knowledge, and limited or no availability of mental health support. This learning is reciprocal though. Over the years, I've learned how much involving people with personal and professional experiences in research can impact on their lives and working practices. Our public advisors, for example, carers, people living with dementia, share what they've learned from being involved and from attending the Liverpool Dementia and Aging Research Forum with their peers. They go back to their support groups or other social networks and can share what they've learned. What's more though, public advisors frequently tell me how being involved makes them feel empowered to speak up for their rights. We've recently completed pilot research on social care needs assessments for people with dementia and their carers, for example. And by being involved in this process and hearing from the participants by coding transcripts themselves, public advisors learned more about this crucial aspect of dementia care. As a result, when I went to a carer centre last week to speak about our work and how people can get involved, one of our long-standing public advisors shared what she had learned from being involved over the years. And note, I did not pay her to speak positively about her involvement. She may get lots of Christmas cake though. This is impact. We share knowledge without realizing it. We don't need to always wait for new findings. But by doing the actual research and by hosting events for people to network, knowledge is shared. Speaking about networks, having done a small evaluation of the Liverpool Dementia and Aging Research Forum recently, we found that attending events such as seminars, webinars, and networking meetings does facilitate knowledge exchange. Indeed, 3 people with dementia and carers stated they had accessed care much easier afterwards by having learned about barriers and facilitators to care. To me, that is the most important impact. So how can we maximize this? Whilst next steps include a greater evaluation of these types of possible impact, what it does show already is that we should value and be more aware of the impact we as researchers can have without having to write a paper for an academic audience. It is difficult to record these types of impact, but surely affecting people's lives this way, without a new medication or care plan, should be important too. Hopefully this reflection on my experiences of impact to date makes you a little more aware of how we all, often unknowingly, impact people's lives. And hopefully for the better.
Thank you for listening. Join the Dementia Research bloggers and share your own views.